All right, I think we're at time, so let's get started. Welcome to folks I don't know. I'm Dr. Laurie Santos, a professor here at Yale University and the teacher of the Science of Wellbeing course on Coursera.org and the host of the Happiness Lab podcast. We wanted to do this Facebook Live event today because I know all of you are struggling with COVID-19 and all the anxieties and the uncertainties that come with it. We know, of course, all the physical things we need to do to protect our physical health, right? We should be washing our hands and socially distancing and so on. But I think a lot of us are struggling right now with the kinds of things we should be doing to protect our mental health. And we need to be just as intentional about protecting our own anxieties and depressions and sort of fixing that as we are protecting our physical health. And this call today is to answer all your questions about the types of things that science suggests that we can do to promote our mental health in this challenging time. What I'm going to be doing is answering all of your questions, so please be sending them in on the side. If you haven't yet sent us an emoji to let us know you're there, please let us know. And I think since we have such a short time, I think we're just going to jump right into it. You'll see me kind of looking over at the side on my chat screen to see what the questions are. And the first question we have today is from Elizabeth, who asks, do you have any advice on dealing with or reducing tension and arguing in your relationship during these stay-at-home orders? This one's a big one. I think you're speaking to me. I think a lot of us are facing the challenge right now that we're spending more time with our spouses, with our partners, with our kids. And that can be incredibly challenging normally, but it's especially challenging in an otherwise anxiety-provoking time. And so I think the first piece of advice I have is to just validate that, like, yeah, this is a big thing that we're all struggling with, but then to sort of encourage everyone to be a little bit patient. The research on relationships and what allows relationships to succeed, folks like Professor Eli Finkel and others, they really suggest that a lot of our relationship success has to do with our expectations. And I think if anything, we might want to just be a little chiller about our expectations for our spouses than we might have been before. All of us are going through this struggling time. And so if you have a spouse who, say, didn't empty the dishwasher or isn't doing their part as much with kids, I think this is a time to be compassionate both with them and with yourself and to kind of downgrade expectations a little bit. But the particular advice I would give is if you think about your relationship with your spouse, there's always things that we really love about our spouse that as in a relationship we do very, very well together. And this is the time to double down on those good things. So if you both connect in terms of hanging out with the kids and working with the kids, that's a time to double down on that. If you both connect on humor, now's the time to be watching a comedy movie together. And so the basic advice is to kind of show them and yourself a little compassion, like now is the time to kind of down-regulate your expectations. But also if there are things that are good in your relationship, be very intentional about promoting those in this tough time. And that sometimes requires a little creativity. If the thing you're great with your spouse is going out to dinner and having these wonderful outdoor dates, you might need to get creative. But with a little creativity, you can really patch up a relationship and kind of down-regulate the stress that we see. Remember, in natural disasters, it is a time that we see things like divorce rates increasing, but it's also the time that we see new relationships forming, people making babies. It really depends on your intentional efforts. You can make this challenging time better in your relationship. So that was Elizabeth's question. Next question we have up is from Melissa. She asks, how do we stay informed with current and updated news without increasing our anxious feelings we may have? This is another one I'm struggling with as well. Like you, I want to be informed about what's going on in my town, what has the president said recently and so on. But I feel like every time I watch the news, I can watch my anxiety skyrocket. In terms of what anxiety feels like in the body, for me, that's watching my chest constrict. I'm watching myself breathe faster. It just kind of doesn't feel good. And so this is a real challenge of how to stay informed without creating more anxiety. The way I've been able to solve it myself is to kind of do that paying attention, that mindfulness about what the news is making me feel. And there's times when it feels like information, and there's times when it feels like I'm already really anxious. I don't want to add to that by adding any more news onto it. And so I think the key is to just be really deliberate about what you're consuming and also to have some choice about what you're consuming. You can pay attention to what's going on, but try to upregulate the information about the positive news. So for example, there's a wonderful hashtag on Twitter called COVID kindness, which you can use to check out to see all the good things that are happening out there. And so I think trying to balance some of the doom and gloom that you're seeing with some of the positive things can be really powerful. But honestly, what I've done myself is to really decrease the amount of news that I'm consuming, particularly before I go to bed. I now have a rule of basically past 6 or 7 p.m. I put my phone away. I'm not on social media as much. I'm really trying to not be consuming the news at that time because I'm watching it mindfully and noticing that it's affecting my sleep. Most of that information is going to be there the next morning. And so find ways to protect your sleep and to protect your own anxiety levels. And it's okay and be self-compassionate if you need to avoid some of that stuff. Again, the 24-hour news cycle is going to be back when you look again. You're not going to miss too much. And so next question up, this comes from a bunch of folks, Lee and Jenna and Anna, all asking similar questions about the mental health needs for frontline workers. They ask basically, how can frontline workers and healthcare workers generally practice self-care and combat anxiety? You know, what's the best way to support these workers? I'm so glad this question came up, and it's great that it came up from so many folks, because this is something that I care about very deeply. I'm so grateful that there are healthcare workers out there really risking their health and their lives to protect me and my family and my community. And so thank you with gratitude for the fact that you're doing that. I think there are lots of intentional things that even folks who are on the front line can do to protect their mental health in this scary time. One of those things comes from a refocus that you really need to protect your own mental health needs during this time. And that means explicitly taking time to kind of pay attention to your anxiety levels and watch the things that you can do to deal with that. I think in between patients, if you can give yourself a break for, say, 3 conscious breaths, 3 very slow breaths where you breathe into your belly and just kind of have a moment to take a second and be present, those things will downregulate your sympathetic nervous system. It'll kick in the parasympathetic activity that we know allows for kind of a rest and digest. And the more you can sort of take short breaks to do that, all the more powerful. I think a second thing I would say for healthcare workers is to make sure that you're reframing what you're doing in as positive a way as possible. I mean, ultimately, you're doing something that's incredibly brave, that's helping folks, but sometimes in the frantic day-to-day anxiousness of that, you can lose that. And there's lots of research by folks like David DeSteno and others that shows that taking time to realize that what you're doing is compassionately helping other people, recognizing that it's a pro-social action, can actually allow you a little bit more resilience, and it can actually upregulate what's called your self-regulation, your ability to do hard things. And so I think kind of turning on your compassion muscles, turning on this idea that you're doing something pro-socially can be incredibly powerful. And the final quick tip, this is more of a practice tip, but for healthcare workers right now, is that there's lots of evidence that specific kinds of meditation practices can reduce burnout, even in incredibly stressful times. And this is true for healthcare workers, but also service providers, and even folks like who work at the grocery store who really have to give up and sacrifice right now to help other people. And the specific kind of meditation is what's known as loving kindness meditation, or metta. It's basically a meditation practice where you work on practicing compassion. You actually think about different people in your life and extend to them information about being happy and healthy. You actually use a mantra of, may you be happy, may you be healthy. But the research suggests that the simple act of doing this, even really temporarily, can allow you to feel compassion, this urge to help people, without the empathy that goes with it. In other words, without the kind of burnout that comes from feeling those other people's emotions. I think this can be an incredibly powerful technique for healthcare workers right now, and you can start it today. Lots of free apps online, from Insight Timer to Calm to even 10% Happier with Dan Harris. They're allowing healthcare workers to use these things freely availably, and they're allowing those healthcare workers to access loving kindness meditation specifically. So jump on and do one of these meditations, even for 5 minutes in the morning, you know, when you're taking your shower. It's the kind of thing that can really improve your kind of resilience and protect you from burnout later on. Okay, so that was about healthcare workers. Now we have a new question from Tracy. Tracy asks, how do you keep yourself positive during this time when living alone, when you're away from your family and friends? I think this one is the flip side of the question that was asked earlier about how to deal with the stress of living with your spouse. There's a different kind of stress that comes from living alone and being away from family and friends in this really hard time. And I think the answer to this one is that you can be physically alone without being socially alone. In other words, you can be using technology to reach out to all those friends and family members. And I think in this scary time, we need to be doing this even more than ever, and even more intentionally than ever. You know, it's one thing to kind of be home alone, but it's another to know that you have, you know, Zoom yoga classes with friends of yours, or a Zoom dinner date with your parents who are far away in different time zones. These are the kinds of things you can build into your day, even if you're living alone. And I think that's really critical. One thing to know is that the science suggests that the act of intentionally connecting in real time, you know, kind of what we're doing right now, where I'm talking to you and you're hearing me in real time, that can be almost as good as a regular social connection. And so we should be embracing these a lot more. I think another thing you can do if you're living alone is to embrace the kinds of things that solitude gives you in terms of other mental health benefits. So I'm thinking about things like quiet time for meditation, or even alone time so that you can engage in a little bit more exercise. Grab a yoga mat even from a small apartment and do one of the many free online exercise classes that are coming now. I think if you're alone in this crisis, it can actually provide some time to reset things and focus on your own mental health in a way that might be tricky if you're not sort of sheltering in place in that very strange situation. And so that was Tracy's question. Now we're moving on to Bree. Bree is asking, how can we stay focused, sane, and productive at work, particularly with the big elephant in the room, which is the threat of layoffs? This is another really huge one. And I think I want to start with this question first by validating it. Yeah, a lot of us are facing the possibility of being laid off from work, having less hours. In addition to this physical crisis and this mental health crisis, a lot of us are facing a real economic crisis, and that's incredibly scary. And so I think the first thing is to just have some self-compassion with yourself about the fact that we're going through this. I'm experiencing this now with many of my graduate and PhD students who feel like they should be working and being just as productive as before, but that can't possibly be true because we're in the midst of a pandemic where everyone is stressed. And even if we're reacting to it really well one day, that doesn't mean that the next day we won't feel it really deeply and be unable to work. And so I think the first piece of advice is just to allow yourself some self-compassion. Give yourself the same self-compassion as you would give to a friend who is going through that sort of same thing. All of us right now are going to be a little less productive than usual. The second piece of advice is actually to remember some of the causal arrows you've heard about on the podcast and in my class. In other words, that we often think that productivity we need to figure out first, and then we'll be happy because we'll be productive at work. But the research actually suggests the other arrow. In other words, that by focusing on our mental health during this time, it can actually increase our productivity. And so that would be the direction I suggest you think about going. What can you do to reduce your anxiety right now, to bump up your social connection so you feel a little bit more like connected and trusting about your community? What can you do to increase a little bit of exercise lately? Those types of things will bump up your mental health. And by focusing on that, you'll end up increasing your productivity separately. And so those would be my kind of productivity tips. First of all, just like, it's not going to be the same. No one's is going to be the same. And in some ways, the whole world is in this boat. So kind of lay off yourself of the guilt a little bit because we're kind of all going through it. And the second is that if you really want to focus on productivity, you need to give yourself some space to do the things that will really help your mental health too. Okay, so that was from Bree. Now we have a similar question from Angela, who's asked, maybe more specifically, I've been laid off because of COVID-19. How do I do the soul searching necessary to figure out what I want to do next and what jobs and industries are going to be fulfilling? I think, again, this is one of these ways of using the negative things in life to sort of see the blessings inside of them. Again, losing your job is an awful thing to have happen, and it comes with a lot of uncertainties, but it also brings with it the possibility of new directions. Like, you can start thinking more about what are the things that you found meaningful about your job? What are the types of things that you would like to build into a job that's coming next? Again, so many of us are in this crisis right now and going through these things, but also all of us, or most of us, are going to get through to the other side. When we're in the crux of it, it's hard to think that there's going to be another side, because right now we're just facing the uncertainty of kind of, months inside, and what does that mean? But like all crises, we're going to get to the other side. And even those of you who are going through economic and other strifes right now are going to find other options when you get out. And I think you can use this time to do some real soul searching. One of the kind of blessings of being in a position of maybe losing your job or losing some hours at work is that you wind up having a time windfall. You wind up having more time. And that means that you can have the blessing of having what's called time affluence, the sort of feeling of being wealthy in time. If you can kind of get around the uncertainty of having the extra time, it can actually be a really powerful time to do things like take time to journal about what you find most meaningful, or engage in the kinds of strategies that researchers like Amy Resniski and others use to job craft, to really think about what you find most meaningful in your work and sort of plan that moving forward. If you're taking the class, Angela, I would also suggest this is a great time to go back to that strengths test that you might recall, trying to focus on your character strengths and getting a sense of what those are. That might be a good time to figure out what parts of your work are mapping onto those strengths. And if you're looking for work in the future, what you could do that kind of builds those up in an even more robust way. Okay, so that was a question from Angela. We're cruising through all these questions. Thank you so much for sending in all these great ones. The next one up is from Jessica. Jessica notes, I've been doing okay so far, but one of my children has been really sad about missing school and his friends. Is there any way I can help him? And again, just start by just validating this. You know, this is a scary and uncertain and an anxiety provoking time for us. It's so much worse for our children, right? Who really just don't have the kind of frontal lobe tools to regulate about this crisis. And so I think anything you can do to help their anxiety, their uncertainty can be incredibly powerful. The first tip I would give for helping kids during this tough time is to make sure that they have a routine. One of the problems about being out of school and out of the typical day that kids face is that they're used to having a certain routine and now it's gone away. And we as humans are creatures of habit. Like, we kind of work best and feel less anxious when we're in a consistent schedule and a consistent routine. So even if your kids aren't in a consistent schedule right now, you should make one up for them. You should find a way that, you know, like breakfast is from 9 to 10 and from 10 to 11, you know, you're doing your math homework, or maybe you're watching cartoons, or maybe you get to play video games. It kind of doesn't matter, but just have a consistent schedule that you end up kind of announcing to your kids and sticking with. The other piece of advice I would give is again, to do the same thing that we need to do when we're feeling anxious and we're feeling stressed and we're feeling sad. In other words, the kind of same types of tips I was just talking about. Kids too can benefit from having social connection through things like Zoom and so on. For older kids, that can be the same way we do it as adults. But even for younger kids, that can be the kind of thing that you set up and structure. My colleague Jamil Zaki, who's a social psychologist who was on the Happiness Lab podcast, he has really younger kids, and he notes that he and his friends are setting up play dates over Zoom. They're kind of going online and printing out the same coloring pages so that kids can color together, color the same thing across Zoom. And that can be really powerful, kind of giving this structure of social connection back to your kids when they need it. But another thing to build in, I think, would be to allow kids to see that, again, this isn't all doom and gloom. If you look, like, there are heroes and real stories of kindness out there. And so another tip would be to kind of expose your kids to the fact that there are good things happening. Tell them your stories about COVID kindness that you're reading about in the news. Talk to them about the heroes that are doing great things. And allow them to experience the fact that there's good stuff out there as well. I think the third and final tip is that, you know, you being the head of the house are going to have a huge emotional impact on your kids. If you've listened to past episodes of the Happiness Lab, you've heard about cases of emotional contagion and the fact that we are often part of these affective spirals where one member of our team or our families feels a certain way, feels panicky, and then that panic can be contagious and it transmits and it gets worse. Remember that you can be the calm in the storm for your kids. You know, if you take time to regulate your own anxiety, you know, do your own deep breaths before you face them. If you're describing this situation as a challenge, not a crisis, you're going to transmit that calm and those positive states to them. And that can be incredibly important. You know, one of the best things you can do right now to help your community is to be embodying those positive emotions yourself. And that often means doing the right things to protect your own well-being, the kinds of things that we've been talking about. Okay, so that was one from Jessica. Now we're moving on to one from Lindsay. Lindsay asks, in your course, we learned about how experiences and not things make us happy. In this time of social distancing and self-quarantine, are there any suggestions you have for experiences we could create independently or with our families? I love this question in part because it's, you know, doing all the things that I suggest, right? Which is like being proactive, you know, using the topics that we've heard about in the course and the interventions we've seen in the course in this special time. I think one of the odd but great things about this current time is that we're all in a new situation. Like, we're all faced with being at home in a way we haven't been before. We have more time with our kids, more time with our families, and things like that. All the research in psychology suggests that we can harness these new situations to form new, different habits. In other words, we can start things that we hadn't tried before, you know, new game nights, new family dinners, new traditions. All of these things, because we're in this moment where we start a new situation, are easy to harness. We can harness what are called fresh starts, which is some wonderful research by Katie Milkman and others shows that these new situations and these new moments of fresh starts allow us to form habits better. And so I think this is a time to think about what creative experiences you could come up with your family. You know, maybe you start cooking dinner with your family in a different way. Maybe you start Zooming, you know, grandma and grandpa into your Zoom meetings. You know, maybe you all engage in a yoga class or some crazy exercise together. Maybe this is the time to start that gratitude, 3 good things that you list before dinner with your family. All these things are easier to start. They're experiences that are easier to get going because we don't really have norms of what our families are supposed to do during this time. It's so new. And that provides this real opportunity, if you can harness it, to put good things in place for yourself and for your family. And so I think for those experiences, get really creative. And that can be with your kids, but it can also be with your spouses. We can't necessarily go out on the typical boring dinner dates or go to that same restaurant you went to every single week. So try something new, whether that's, a new like spot in the house to have dinner, a new candle, like put down a tablecloth, like try a new meal. Like you can create these novel experiences. And if you frame these things as novel experiences, that can be powerful for your well-being as well. Okay, so that was Lindsay's question. Moving on, we're really scrolling through, so I'm encouraging you again to send in your questions if you haven't yet. We have about 10 more minutes in this chat, so send them in. Next question comes from Cheryl, and Cheryl asks, what should we do about sleep problems? I can't sleep, anxiety, uncertainty, etc. Cheryl, you are really speaking to me because I was going through this pretty badly about last week when I was just realizing that I just was unable to kind of fall asleep. Even though I was trying to get to bed at a reasonable hour, my mind was like, it was really, really hard. And so I'll share with you the things that I've done to promote sleep. And they're all things that come from the research. One of these is to harness the power of ritual before you go to sleep. There's lots of fantastic work by Mike Norton and Francesca Gino showing the power of ritual to control things when things feel out of control. And I think right now, one of the things that's preventing us from sleeping is that everything feels really out of control. And so I've started some, seemingly dumb, like private sleep rituals. I kind of set up at night and kind of remake my bed if my bed wasn't made before. I have found all the old like lotions that I have, in my cabinet that I haven't used in a while. And like every night before I go to bed, I kind of like, put some lotion on and try to be really mindful about the way it smells and the way it feels and kind of get into bed. It sounds really silly, but harnessing this ritual, the science suggests, can kind of make you feel a little bit more in control. And it can also train your body that like, oh, wait, after I do the ritual of the lotion, then I go to bed. A second thing that I've done, and this has probably been even more powerful, is to really regulate how much anxiety-provoking material I'm looking at right before I go to bed. I know I've told lots of you about the dangers of phones, and particularly the dangers of phones right before you go to sleep. But this is a time where we really need to be following that advice. Basically, I have a rule now that after 8 p.m., I put my phone away. I just put it on silent. I put it in a specific spot in my bedroom, and I'm not allowed to use it anymore, which is tricky for me because I'm really used to kind of scrolling and using my phone before I go to bed. But I've tried to substitute that habit with something else, because as we know from our habit research, if you have a cue but no action to do, it can be really hard to overcome a bad habit from before. And so my new habit when I have the cue of like, oh, I really want to check my phone before bed, is a physical book. I've just found old books in my house that I either want to read or were sitting on that shelf and I haven't had a chance to yet, and those are there. And so those different habits of kind of beginning a sort of sleep ritual that's like healthier, and getting rid of the phone, which is bad because of its light, but also because on the other end of that phone right now, there's a lot of anxiety-provoking content that can be really powerful for me. And I guess maybe the third thing is just to prioritize it. I've been trying to, given that we all have many of us have a little bit more flexibility with our work time, I've been really trying to move any work meetings that are early in the morning to a little bit later. So even if I can't get to sleep or I'm having some restless sleep, I have a little bit more time to make it up these days. And so highly, highly encourage you to prioritize sleep. Remember, sleep is essential for your mental health, but it's also one of the other things you can do right now to protect your immune function during a time when we all really need to make sure our immune function is as high and as effective as it can possibly be. Okay, so up next question, Marisol is here and she is asking, I have a couple of family members that have tested positive for COVID-19. I feel like my mind is focused only on that. So how do you suppose I go about my day with caring for my family, but also taking care of my own mental health? I think this is, again, I'll start by doing, I think what's important here, which is to validate this. Many of us are going through this situation where we know people who are positive for COVID-19 or presumed positive for COVID-19. I think a different, scarier situation when you can't get tested. And that's incredibly scary. And sometimes that comes with the additionally awful thing that if you're trying to physically distance yourself, or if you're in a vulnerable position yourself, you might not even be able to help them in the normal way because you might need to maintain some distance from them. And so I think the first thing to do with this is to have some self-compassion. This is an unprecedentedly bad situation. And you kind of just need to be nice to yourself and stop feeling guilty. If you're in the position where you want to be helping your family members and are feeling frustrated that you can't interact with them directly, this is for people who, for example, have family members who are far away or family members who are vulnerable that you can't get to. I think one thing the research suggests you can do to help with that is to allow those pro-social urges to come out another way. Are there other elderly family members you can help? Or something else you can do that's doing good in the world, even if you can't do good for that one person? I think that can be particularly powerful. But in terms of just kind of going through that situation with family members, I think part of it is to find ways to reduce your own sympathetic nervous system activity. I think the stress of having family members who are sick on our own bodies can be incredibly anxiety provoking. And I think you need to just take time to kind of breathe. And again, we talked a little bit before about kind of doing these slower breaths, these belly breaths we're talking a lot about on our podcast and things. But that's the time to do that sort of deep breathing. And again, that's useful because it's going to help your own immune function. It's going to sort of shut off the fight or flight sympathetic nervous system activity and allow you to turn on this parasympathetic nervous activity, which is what we need right now to sort of rest and digest. And that will help your immune function. But it'll also give you the bandwidth to deal with that stressful situation. Remember, even if it doesn't feel like it, there's a lot that you can do to embody calm yourself in order to help the other people in your life. And so very, very hard and scary situation, completely validating that. But again, know that there's simple actions you can take to kind of take control of your own emotions and sort of work with them even in this really scary time. Final question, because we're kind of at time. Our final question comes from Holly, who asks that her question is around trying to do random acts of kindness and make social connections during this time. She has a few ideas in mind, but it's hard to find ways in everyday life when you're in isolation to do this more. Agree completely. You know, in the course and on the podcast, we talk a lot about these kind of random social connections, you know, the chatting with the barista social connections that happen regularly. You know, this is the stuff that we're missing more and more now. And so one of the tips I've been giving is to try to build in social connection. That's not the like very formal conference call with the folks at work, but really informal type things. You know, like I'm going to do a yoga class, just like call, you know, text a few friends and say, hey, who wants to jump in with me? Or I'm going to have a half hour where I'm chopping vegetables and trying to deal with whatever's in my pantry to cook tonight. Let me see if I could Zoom a friend who can jump in with me then. I think these informal social interactions can be incredibly powerful. We have to intentionally build them in a way that we didn't before. But two things there. One is that just takes a little bit more work. And the second thing is if you form the right habit now, you might be able to import that later so that when this whole crisis is over, you're doing those things as well. In terms of the random acts of kindness part, I think there's so many things we can be doing to reach out to others. One is just to recognize that this act of sheltering in place, staying home, is a pro-social action. You are helping other people and helping to flatten the curve, maybe saving thousands of lives by your simple action. So make sure you reframe it that way. But the other thing is to use whatever windfalls you have, whether that's extra time because you're not working as much, or a little financial windfall. You know, those of you who aren't paying gas to commute or buying that coffee at the coffee shop regularly that you normally buy, those are little financial windfalls that you can use to help other people. And so what can you use to use that money to say, help local businesses who need some help? Or if you just have extra time, what can you do to kind of contact elderly family members who might need a connection right now? Or even talk to your congresspeople about what they should be doing. Like these are the times when we can use our temporal windfalls, our time windfalls to help other people a lot. Okay, I think that was a lot. I hope that you heard some fantastic suggestions. I want you to keep in mind the main thing that I keep mentioning, which is self-compassion. This is a really challenging time, and it's important to be nice to yourself. But one of the things you can do to be nice to yourself is to remember what science suggests about the kinds of things that can improve your well-being. We know that you're washing your hands and doing good stuff for your physical health. I hope this has given you a bunch of tips for what you can do for your mental health too. There's so many comments on there sending gratitude my way. Thank you so much. You are very welcome. I hope this has given you some useful tips, and I thank you for signing on. Thank you all so much.